And then, so welcome to our PCOS Masterclass starting today. This is going to be 3 days of learning all about PCOS. So it'll be today, tomorrow, and then Thursday. And then before we, oh, wait a second here. Sorry, I'm just having trouble with the, oh, here we go. There we go.
There we go, perfect.
Okay, I think I've got all of the tech stuff under control now. So before we dive in, we're going to introduce ourselves so you guys can get to know us a little bit first. So Dr. Laura, why don't you go ahead first?
Great. So hello, everyone. I'm Dr. Laura Von Hagen, and I'm a naturopathic doctor at Higher Health. And I have a strong clinical focus in women's health and PCOS, just as Dr. Kira does. And it's something that I'm super passionate about and really happy that we can finally get this masterclass underway and that you're joining us this week.
Great. And I am Dr. Kira Taylor, naturopathic doctor, also at Higher Health. Similar to Laura, I have a strong clinical focus in women's hormonal health. So from PCOS, to PMS and fertility and menopause. And really, I am just so passionate about, helping women to understand how their hormones impact almost all areas of their health and well-being. And then, bringing in those kind of naturopathic evidence-based practices that we're going to talk about today to really bring kind of balance to the hormone into the system so that you can feel good all month long, which is why we're so excited to kind of share all about how PCOS can impact all areas of your health and kind of things that you can do about it. So that's why we're so excited to have you guys here. Just a couple of housekeeping notes before we dive into the content for today. So there is, when you're here on Zoom, there is both a question and answer box and a chat box. So feel free to put any questions that you have in there or comments as we're going through. We might engage in it as we go through and answer questions kind of in real time. We've also put some time aside at the very end in order to address your questions then. And then if you have any questions after today, feel free to send an email to info@higherhealthcenter.com. Or if you're part of the Facebook group as well, you can throw your questions in there and we'll address them tomorrow. And then also if you know anyone else who can really benefit from this information, feel free to send this over to them so they can join us for the other 2 days of the masterclass. And we will be recording everything. So we will be sending out all of the recordings after this.
So yeah, even if you have to leave a bit early today, you will get the recording, so no worries. And just while we get started, just as a reminder, really this is for educational purposes only. We want to really provide some insight on PCOS and how it's affecting your hormones and your health. So before you make any changes to your own life or start any supplements, always best to check with your naturopathic doctor or your healthcare provider, as they can best advise you.
Okay.
All right. So who's in our community? What are the things that we hear over and over again? I think it's about saying, if I had a nickel every time, probably now it's more like if I had a toonie every time I heard someone say these things. These are quotes that come up in our office when we're really talking with our patients. And that's what I love as a naturopathic doctor. We have the time to we sit down and understand our patients and what their health concerns are. So women come in, whether or not they've been diagnosed with PCOS or we suspect it, they're, like a lab rat running on the treadmill all day, exercising, cutting calories, and they just don't see their weight budging, right? Or, their periods have always been irregular. They never know when they're coming. They're 60 days long, they're 40 days long. And their doctor's just like, just go on the pill. It will regulate your cycle, even though you're not getting a true, period at that point. So we're not actually fixing the root cause of your irregular cycles. And the last one is the cravings. When I ask patients, what do you crave? And their answer is sugar. All I want is sugar. And they feel like they're reaching for anything sugary in their house. These are the type of people that we're working with. And these are the things that we treat and help women with every day.
Yeah, these are the things, like Dr. Laura said, that we just hear all the time. And what I think is so exciting about what we're going to share here as well, it's that kind of naturopathic approach that we bring to really getting to the root cause of like what's causing the cravings. And we'll get into why that happens today, and the irregular cycles and the exercising, and kind of bringing that approach and mindset to it, compared to just kind of treating it with a pharmaceutical medication, which in some cases might be the right option, but just kind of understanding some of those underlying challenges and things that are happening and how we can address those. Mm-hmm. So so this is introducing our higher hormone health framework. So these are mindset, movement, and micronutrients, or the 3 M's, also as we like to call them. And this is really bringing context into your hormone health and hormone balance, and the kind of the foundations and the pieces that we always like to touch on with patients. So mindset is really all about the thoughts, the self-talk, the energy that you're kind of bringing to your healing journey. And especially with PCOS and hormonal conditions, when your hormones are not functioning properly, it can be really, really frustrating, a really frustrating experience. And like, you don't have control over what's happening in your body. And that's why the mindset and the thoughts that you're thinking is so important, because those thoughts help to trigger action and movement. And so we're hoping that over these 3 days together, we can kind of share insights to help foster a really positive mindset when it kind of comes to your PCOS and hormone health journey. And then movement is the second M. So we all know that movement, exercise, and whatnot is really important. And we are going to be talking specifically about movement for PCOS, so how to benefit hormones and whatnot in PCOS. And then micronutrients is the third M. And this really is all about all of the nutrients that we're kind of feeding in our body, that are going to the cells, feeding us on a cellular level, helping our organ systems to work properly, and hormones. And we'll be going over that. And this includes nutrition, targeted supplements, so things like nutraceuticals, and then IV nutrient therapy. And so we will really be diving into diet and nutrients for PCOS in the next 3 days together. Okay, so this is our agenda for the week. So this is everything that we will be covering. Today, we are doing an overview of PCOS and really diving into the different subtypes of PCOS. So you guys might be surprised to learn that there is more than just one. Tomorrow, we will be going over no-nonsense diet and exercise for PCOS. And then Thursday is going to be day 3, which we were going to be going over covering the blood work that you need to have done, and then where we're going next.
All right, so for today, specifically, we're going to focus on how do we actually diagnose PCOS, so going through the criteria. What are the symptoms? So again, PCOS stands for polycystic ovarian syndrome. So it's a syndrome, which means there's a collection of symptoms. So no 2 women ever present with the same symptoms. So that's why sometimes it can be tricky to diagnose, because we're kind of grasping at straws with different things that can be going on. And you'll see it's quite the list of symptoms. And these are things that you want to watch out for. And then what type are you? So there's 4 kind of main types of PCOS. Most common is our insulin resistant, second inflammatory, post-pill, which is like a temporary state, which we'll go through. And then the 4th, which is an adrenal PCOS. And you don't have to fit into each separate bucket. Often women are a combination, but that insulin resistant is the most common. And that's why we want to look more individually at you and your PCOS type when it comes to treatment options. All right, so did you know, quick little fun factoid, PCOS is actually the most common female endocrine disorder. Anywhere from kind of like 8 to 15% of women have it, which is why we say around 10% of women have it. So that's 1 in 10. If you think of your friends, that's a lot. So it's the most common endocrine disorder. It's also one of the most common causes of infertility as well, but definitely something that's treatable. It's both metabolic and hormonal. So even though it's ovarian syndrome, it's really a metabolic syndrome. And you'll see when we go through the hormone cascade, how much influence insulin has on our other hormones. The exact cause is unknown, but it is highly genetic. So we're seeing more and more that there's certain genes related to PCOS. And if your mother had PCOS, there's changes that happen while you were in the womb that predisposes you to having PCOS. So I hear all the time, did I cause my PCOS? If I'm having trouble losing weight, is it my fault? It is not your fault that you have PCOS. You did not cause it. Your diet did not cause PCOS. Your weight gain did not cause PCOS. Those are symptoms of PCOS. So keep in mind, it's likely genetic and it is not something that you did wrong.
Yeah, it's such a good point. And we really want to highlight that over the next few days, is that there's nothing that you have done that's kind of caused PCOS. It's more of things that we can put in place to help manage the symptoms of it. And it is like, it's so interesting because it is the most common female endocrine disorder. And I think that really, I feel like there is a lot more, and Dr. Laura, you can say if you agree with this, but way more like awareness in this condition now, like over time, whereas probably like a few years ago, a lot of people probably didn't realize that a lot of the symptoms they were experiencing like was PCOS. But now in practice, I find that a lot of patients are coming in and they either suspect PCOS already or already kind of have talked to their doctor about it. They don't have tons of tools about what to do about it, but they do have like an awareness, as opposed to me saying, oh, I think this might be PCOS.
Absolutely. I've seen that shift for sure.
Yeah. Okay, so speaking of this being a syndrome and having a lot of different symptoms, these are some of the most common symptoms that Dr. Laura and I both see in practice. Feel free in the chat, like if you guys feel comfortable, if you want to share any of these symptoms that maybe you experience or just symptoms that you've kind of heard of, you think that are associated with PCOS, feel free to jump in there. So the first one is irregular absent ovulation or periods. So really like a typical menstrual cycle is kind of anywhere from about 24 to 26 days to like 34 days, somewhere in that range. With PCOS, we often see either someone might have like no period, it's not coming at all, or maybe they're just coming every few months, or they're having a longer cycle, like 40 to kind of 60 days consistently. So that's a big sign of it. The unwanted hair growth, so maybe on the chin, chest, or back area, this is kind of a sign of those higher androgen levels. So we'll get into all the hormone imbalances in a little bit, but that's one of the signs. Hair loss in the head, that can be, so it's similar to the androgen picture where it can be kind of be that like male patterned where you're kind of losing hair on the front. Cystic acne is another sign. Weight gains, we've already touched on the metabolic component, but the weight gain or just inability to lose weight, sugar cravings and binge eating, blood sugar dysregulation is leading into all of that. Same with mood swings, depression, low energy, and then infertility. So Dr. Laura said that, PCOS doesn't mean that you're infertile by any means, but it can, I think, and this also, I think, probably in the past, maybe when women were experiencing trouble getting pregnant and then they went to a fertility clinic, that might have been their first point of contact with knowing that they had PCOS or kind of hearing about it. Now a lot of people will know a bit earlier, but it's just about us, you being here and kind of learning the tools and things. We just need a little bit more like assistance to get the body ovulating regularly and things like that. But yeah, these are some of the common symptoms. And then I also want to highlight here, like how I was saying at the beginning, that, it's so fascinating how our hormones impact so many areas of our body and of our health, because here we're seeing, yes, of course, our menstrual cycles are affected. So like the irregular periods, but also hair, skin, mood, energy, like all of these different areas are impacted. So we're also going to kind of highlight why that's happening as well. Okay.
So that is, as we said, symptoms that you may or may not be experiencing. But to actually get a diagnosis of PCOS, we use what's called the Rotterdam Criteria, and you need to have 2 of the 3 following criteria. So you don't have to have all 3, but definitely 2 in order for you to get a diagnosis. That first one is the oligo or anovulation. So that means few menstrual periods or no menstrual periods. So maybe you get your period every few months, or you're not getting it at all. Hyperandrogenism, so signs of excess androgens, which are our male hormones like our testosterone. So either clinical, so hirsutism, where you're seeing hair on the chin, but then male pattern baldness on top, or biochemical. So what we call our free androgen index, that's okay, or free testosterone is raised. And so you might not have signs of cystic acne, but maybe you have really high levels of testosterone on blood work, or really high DHEA, or really low sex hormone binding globulin, right? So there's lots of blood tests that we're running to look for this. and then polycystic ovaries on ultrasound. So they actually call it a string of pearls. So you'll see kind of all these, follicles arranged around the exit of the ovaries, but the body's trying to ovulate, but it's not able to release that egg. So then they turn into cysts and create this kind of pearl necklace appearance. And those are the 2 of the 3 that you would have.
Perfect. Okay, so here is our hormone pathway that we wanted to share with you guys. And this might look a little bit overwhelming at first, but we just kind of there's going to be a few kind of key takeaways that we just want to show from this hormone pathway. And the first one is that, Laura, can you see my cursor moving?
Yeah, I can see it moving.
So we can see here at the start, so everything starts with cholesterol. So all of our steroid hormones, so all of these hormones come from cholesterol, which is really important when you think about the fact that it's very important to have good sources of healthy fat in your diet, because all of these hormones are coming from cholesterol as the starting backbone. Then it's going down into pregnenolone. And then in the ovary, after ovulation, that's when it will become progesterone. And then over in the adrenal glands, that progesterone in the adrenal glands will become cortisol. And then this 17-OH pregnenolone in the adrenal glands will become DHEA, which then goes to the ovaries, which will produce testosterone, and then that goes down to estradiol. So I know it seems like quite a few pieces, but really the important things that we want you guys to understand is that everything's kind of starting from cholesterol, and then all the hormones are connected and like influence each other, right? Because that DHEA is what's then converting into testosterone, which is then converting into estrogen. So with PCOS in particular, what we see is an issue with these androgens over here. So often we see high amounts of this DHEA and the testosterone being produced from the adrenal glands or the ovaries. And then maybe, depending on the situation, like there might not be enough converting to estrogen. It kind of depends on what happens with that piece. And then same with the progesterone over on the other side, is that that's also about, if you're not ovulating, then you're not producing that progesterone. So we need to be ovulating regularly in order to produce the progesterone there. So hopefully that's helpful, just to kind of map it out a little bit in terms of how the hormones are all interconnected, and then just kind of the areas that we're going to be focusing on with PCOS. Does that sound good, Laura? Do you have anything to add to that, or all good?
No, I was there. I stepped out for a second to let my cat outside because she was really driving me nuts. So apologies, I had to move away for a second. I was like, get out.
Okay, so now we are going to go into the different types of PCOS.
All right, so we're going to start with that insulin-resistant PCOS, and we're going to talk more about insulin tomorrow when we do diet and exercise. But really where we see is this insulin resistance, the body is not responding to insulin properly, and blood sugar dysregulation causing a lot of your symptoms. And what happens, which wasn't on the hormone map, but similar to that area where the androgens are having an issue, is if we have high levels of insulin being produced in our body, that can actually trigger even more testosterone to be produced in our ovaries and cause a host of unwanted symptoms. So there's also this whole other insulin piece coming in and driving testosterone production from our ovaries, which we don't want. So how do you know this might be you? You feel shaky and nervous if you do not eat. So let's say you're really busy and you skip a meal, and you feel shaky or nervous. Or you're someone who's like, I need to eat every few hours, or you find you're sensitive to high sugar foods. So maybe you eat a donut, but your body feels like you just ate 40 donuts and you totally crash a few hours later. And so again, if you feel comfortable, feel free to chime in the chat. You're like, yes, that is me. So that insulin resistance PCOS is where you eat a donut, but your body thinks you just ate 40 donuts. And the next thing you know, you're on this total blood sugar roller coaster. Or if you miss meals, you feel really shaky and nervous and you just can't get good blood sugar control. And that comes back to insulin.
Yeah, and so the other thing too, which Dr. Laura mentioned at the beginning, is like we're going over these 4 types, but there's a lot of overlap between them too. So here we're talking about, this is the second one, and we're talking about, this is the inflammatory or immune-related PCOS. And this is when there's chronic inflammation, and that can then impede ovulation. And then it stimulates the production of more androgens from the adrenal glands. glands. So those DHEA and that the DHEA and then the testosterone. So here, some of the questions to consider, and again, yeah, of course, you guys can chime in if you notice any of these, but some questions to ask yourself is, do you feel run down and like you're running on empty all the time? Are you experiencing significant stress in your life? We're going to see that stress plays into a couple of these as well, from that like adrenal gland piece. But those are some things to kind of consider in terms of this second type of PCOS.
Mm-hmm. And then the third type, this is post-pill PCOS, which is certainly controversial in the sense that it's not a true type of PCOS, but more of a temporary state that you might see after coming off of birth control. And so you've been on synthetic hormones for a long time, which shut down your own production of hormones. And then we have this temporary state where the body is readjusting and trying to learn to ovulate again. So this is someone who comes in and goes, I came off birth control 6 months ago. I still haven't gotten my period. And an important thing to ask is, well, before birth control, did you have normal periods? Because, for instance, in my case, I got put on birth control for a regular period. So no surprise, then after I came off birth control, I still had a regular period, right? It didn't fix my PCOS. So certainly if you're someone who went on it for a regular period, your periods will likely be irregular after it. Whereas if you had regular periods before, and now that we're having trouble bringing it back, you might not have true PCOS. It might be more of this post-pill PCOS, but that's still something we can help with your body readjusting and getting back to that normal state where you're ovulating again.
Yeah, that's such a good point, because this is something that we do see in practice all the time. And this is something that when
I just see here.
Oh, does someone?
No, go ahead.
Oh, and did I freeze for a second, or is it okay?
I'm all good on my end.
Okay. What I was going to say is in practice a lot, we do see when a patient comes off of the birth control pill, if they're kind of experiencing any symptoms, that is one of the questions that we always ask is, what were your menstrual cycles like before going on the pill? Because yes, the pill will kind of regulate that like bleed that you're having each month. But if you have an underlying imbalance in those hormones that we showed and in those pathways, because remember with PCOS, we're going back to it being largely driven by genetics. So it's kind of like how your enzyme and pathways are running. So all of those, whichever way that it was kind of happening before is probably going to come back now. So that's just something to consider. And so that's why these are great questions to ask for this type of PCOS. And then this is the fourth type of PCOS, and this is the adrenal type. So this is when there's high levels of DHEA being produced in the adrenal glands due to cortisol dysregulation and stress. And then that high level of DHEA can then impede ovulation and then impact the amount of cortisol that's released after. So going back to that kind of whole hormone cascade that I showed there a few minutes ago, is this DHEA. This is produced mostly, almost 100%, like mostly in the adrenal glands, where a lot of the testosterone is produced in the ovaries. So when we are chronically in fight or flight and very stressed out, we produce a lot of cortisol, and then also producing a lot of DHEA to kind of protect, buffer the effects of that cortisol. And then the DHEA is an androgen. So then it's kind of going down through those other pathways and can be impacting symptoms. So some of the questions here to think about: are you feeling burnt out? A really big sign of that is if you're exhausted first thing upon waking in the morning. Some people can also kind of experience that like wired but tired sensation, right? So you feel like exhausted, like you're mentally so tired, but your brain is kind of like, or you're physically so tired, but your brain is kind of constantly going. So that's one thing to think about. And then, do you have low blood pressure and low energy? So low blood pressure can also be another sign, or if you frequently feel really dizzy when you stand up, like kind of things like that. And again, this is showing the, there is interconnection between them, right? Because there's a lot of overlap with how all of these hormones kind of regulate with each other. But this is a good way of breaking it down into some of the nuances, I want to say, in terms of what hormones are kind of dysregulated underneath.
And yes, thanks. I see someone chime into the chat. I will die if I don't have 40 donuts right now. And yeah, so kind of that like insulin resistant PCOS is like, you're like, I need to eat everything and anything in my fridge right now, which usually involves sugar. And that's that blood sugar dysregulation. So thank you for sharing that with us.
Yeah, it's such a telling sign too, when you just feel like that like blood sugar kind of dysregulation, when you feel that shakiness, lightheaded between meals, anything like that. Okay.
All right. All right. So I'm just going to give a quick recap of today. So today we went through common symptoms of PCOS, how we actually diagnose our PCOS, and then what are those kind of 4 subtypes of PCOS. So thinking where you might fit in. Again, I'm Dr. Laura Von Hagen, and then we have Dr. Kira Taylor here, and we're both naturopaths at Higher Health Center. And so we really, really glad that you joined us for today. If you had to hop off early, no worries, you will get the recording. And again, feel free to share the link with anyone you know who could really benefit from watching these webinars. And then we're excited for tomorrow. So what's happening, Kira? What are we going to be covering?
Yeah, so tomorrow is going to be it's going to be awesome. We're diving into diet and exercise for PCOS, talking about the link between nutrition and exercise for managing your PCOS symptoms without the birth control pill. We're really going to dive into kind of all of the myths and things like that surround PCOS, because there's so much stuff out there online. So we are really, really excited to dive into that now that we've kind of set the framework for what PCOS is, kind of giving you guys an understanding maybe of where you sit within those subtypes, and then tomorrow taking it a step further.
And now I just commented there in the chat. So again, if you have any questions that you think about afterwards that maybe you're not comfortable asking now, you can always send us an email at info@higherhealthcenter.com. But if you have any questions about anything we covered today, we have a couple minutes. We'd love to hear from you. So feel free to type in the chat or in the question and answer box, and we'll do our best to get through them.
Yeah, because we'll see if anyone has any questions now, we can answer. And then, yes, the recording will go out later today. Oh, great. Do you want me to take the first one, Kira, and then you can? Oh, sure. Yeah, let me just, yeah, you go ahead. Okay. So the first question is about prolonged fasting, because sometimes some people will do like a water fast. Fasting for PCOS has been studied, and they've actually studied it with Ramadan because that's an easy kind of way to study a large population, and looking at women specifically who they had PCOS, and they actually found it to have a bit more of a negative impact. And we'll get into a little bit more tomorrow as to why we're not super fans of fasting, or really even like prolonged intermittent fasting or time restricted feeding, because in some cases this can be too much of a stress on the body and disrupt their cortisol even more. And so certainly making sure that we're eating regular meals, which we'll go through, but not necessarily doing prolonged fasting, because when we looked at women after Ramadan and their hormones, there really wasn't any much benefit in terms of improving their symptoms of PCOS. So we prefer a more balanced approach with blood sugar regulation than having to go with really strict fasting schedules. Perfect. And then the other question is, are there tests that you can take to determine the type of PCOS you have? So we will be going all over on day 3, the blood tests that you really need to have for PCOS and what it's going to tell you, because there certainly are some of the blood tests that we'll go over that can kind of help us understand, like, is insulin dysregulation happening? Which of the hormones are out of balance in terms of DHEA and testosterone? So we'll dive deep into that on day 3, all about the specific blood work that we recommend you guys running. And then I'm going to chime in here. I have another question about someone very common. So, I've been diagnosed with PCOS because I have a string of pearls. So they see that, multiple follicles peripherally arranged on an ultrasound, but regular periods and the rest of my blood work is normal. Do I actually have PCOS? And I would say it depends, which is the answer to a lot of things. So certainly I see patients where I go, I'm not sure you have PCOS, but more of this PCO, and we're sort of on the spectrum. So I'm going to treat you as though you have PCOS based on your symptoms. So going back to that individualized treatment. The other thing is often like, here's my blood work came back normal. And then when I look at what's actually been run, I'm like, well, you haven't been thoroughly assessed. Perfect example when we talk about day 3 with lab work. Maybe they tested your fasting glucose, but not your fasting insulin. And fasting insulin is far more important for measuring insulin resistance. Maybe they only tested total testosterone and not free, right? And so often I'm seeing that you haven't actually been thoroughly worked up for PCOS.
or they're just kind of treating the paper, not the person. So I prefer to treat the person and actually look at their symptoms and relate that back to their health goals than saying everything's fine and, kind of brushing that aside. So definitely lots to cover in terms of testing on day 3. But I would say, 1, you haven't been thoroughly assessed, or maybe you're someone who's a bit more PCO versus a full PCOS, but we still want to treat you based on how you're kind of presenting.
Yeah, that's perfect, because also going back to that original, the Rotterdam criteria where you're meeting, you meet kind of like 2 of the 3. So one of them is only one of them is the cysts seen on ultrasound, and then the irregular cycles and the signs of hirsutism. So sometimes you don't even need other blood work to meet that criteria. And it's just kind of there is room for us to bring in that clinical assessment in terms of making that diagnosis, in terms of the symptoms and the symptom picture that we're seeing. But definitely, echoing Dr. Von Hagen about the importance of the full assessment and all of the blood work, which we're going to talk about on Thursday.
Yeah, can't wait. I love blood work.
Yeah, we're so excited. So that's great. I think that's all the questions for now. Feel free again to email those in if you guys have any more, and we'll address them tomorrow. So we will see you again tomorrow at noon.
Right. Thank you, everyone, for joining us. It was so much fun today.
Okay. Bye.
Bye, everyone.